This will serve as your 1 hour of continuing education for Certification 2 or administration of food and prescribed medications through a stable labeled gastrostomy tube or a stable labeled jejunostomy tube. To renew your certification, you must have 1 hour of continuing education on or before your renewal date or your anniversary date. You must demonstrate competent skills related to feeding and medication administration through a G tube or a J tube with a nurse. If you do not maintain your Certification 2 because you did not receive the continuing education training, Certification 2 will be suspended for up to 60 days. You may not give medications, supplement, or water through a tube during this time. When your recert has been completed and entered into the MAIS system, you may resume Certification 2 tasks. Just as a reminder, you must maintain Certification 1, Medication Administration, to qualify for performance of tasks required of staff with Certification 2, Administration of Food and Medication, by a stable labeled G or J tube. Certification 2 course objectives. Here's what you're going to learn. How to identify the various kinds of enteral feeding tubes and their components. Enteral is just another name for a feeding tube. Describe the internal and external placement of enteral feeding tubes. Demonstrate the techniques for administering formula and medications. Distinguish between a G and a J tube. Describe how to respond to common complications and/or emergency situations. Explain each point of the daily maintenance checklist for enteral feeding tubes. Understand that prior to the licensed nurse delegating to certified DD personnel feeding or medication administration per a G or J tube, the nurse must determine that the individual's condition is stable, the gastrostomy tube or jejunostomy tube is stable and labeled, DD personnel who will be receiving the delegation have had individual specific training for administering feeding and medications to the person receiving these procedures from the delegated personnel. The gastrointestinal tract is a continuous path from the mouth to the rectum where digestion and absorption of nutrients, water, and medication occurs. The normal GI tract is divided into two parts, the upper and lower tract. The upper GI tract is where digestion and absorption of most nutrients, water, and medication occurs. Food enters the mouth where it is chewed and partially broken down by saliva, which contains enzymes that begin the digestive process. When swallowed food enters the esophagus, where it is transported to the stomach. On swallowing, the epiglottis closes over the opening of the trachea, protecting the airway from aspiration of swallowed liquids or solids. The area between the esophagus and the stomach is the gastric esophageal junction. The purpose of the junction is to act like a one-way valve into the stomach and prevent reflux or backflow into the esophagus. The stomach is a curved pouch organ that is located under the diaphragm in the middle upper portion of the abdomen. Acids in the stomach kill off harmful bacteria and further break down the stomach contents. The lower end of the stomach is the pyloric portion. Enzymes in the stomach control the passage of food through the pyloric muscle that acts as a one-way valve into the small intestine. The small intestine averages 12 to 26 feet in length and consists of the duodenum, jejunum, and ileum. As partially digested food particles move through the small intestine, enzymes break the particles into nutrients and waste. Small finger-like projections known as villi contain blood vessels that absorb nutrients into the bloodstream and move the waste products through the digestive tract to the large intestine. The lower GI tract consists of the large intestine and the rectum. The function of the large intestine is to consolidate undigested material into fecal waste that is disposed of through the rectum. Problems in the GI system can occur at any point along the way. There are a number of tests and studies that the physician can order to determine the site of the problem. Insertion of a gastrostomy or jejunostomy tube occurs when the individual cannot take in adequate food, nutrition, or liquids by mouth to sustain normal growth and development and maintain health. A feeding tube may provide for all the person's nutritional intake. A feeding tube may also be used to provide nutritional supplements to individuals who are able to eat but unable to eat enough. Tube placement can be temporary or permanent based on the individual's needs. The tube will initially be placed by a surgeon. The person will be under a general anesthetic. The surgeon cuts an opening into the abdominal wall from outside to inside the stomach. He then places the tube through the opening. The opening will heal around the tube, forming a channel from the outside to inside the person's stomach. There are many reasons why someone may need a tube placed in their digestive tract. The following are just a few reasons. Swallowing is a complex act that involves the mouth, throat, epiglottis, and esophagus. A cycle of swallowing means chewing food, moving the food to the back of the mouth, moving the food past the epiglottis and trachea or airway into the esophagus and then into the stomach. Difficulty swallowing can occur at any point in the swallowing cycle. Nerve and muscle problems may lead to impaired swallowing. Impaired swallowing caused by obstruction of the esophagus will result with a feeling of food or liquids sticking in the throat or upper mid-chest area. Also, a person may have swallowing followed by vomiting or repeated episodes of vomiting. Swallowing disorders may cause airway obstruction, choking, breathing problems, aspiration pneumonia, weight loss, dehydration, changes in behavior or behavior problems, and changes in sleep patterns. Always report the issues to the nurse. Some examples of medical conditions that may affect the swallowing include stroke, cerebral palsy, dementia like Alzheimer's disease in persons with Down syndrome, medication side effects, and muscular dystrophy. Other conditions which may cause difficulty taking in enough food by mouth: pain, lack of sense of hunger or repeated refusals to eat, gastrointestinal problems, impaired absorption of nutrients from the small bowel, difficulty chewing or swallowing, decreased taste or change in the sense of taste, increased metabolic needs. Some tubes you may encounter are G-tubes, Mickey buttons, PEG tubes. They go directly into the stomach. They are held in place by a balloon. Gastrojejunostomy tubes or GJ tubes are placed surgically in the stomach and small bowel in a single unit tube. This surgery is performed in a hospital operating room with the individual under anesthesia. The surgical gastrojejunostomy tube has a port for direct feeding into the small bowel and a separate port for access simultaneously to the stomach. There will be a specific order for supplement medication and water for the G port and J port. Jejunostomy tubes or J tubes go directly into the small intestine. Some replacement tubes have a balloon inflation port at the top of the tube near the feeding port. Only a nurse or a doctor will insert or remove water from the balloon port. The balloon port is used to inflate the balloon with water. This secures the tube inside the person's stomach. The balloon is inflated with water using a syringe. Balloons help to hold a tube in place inside the stomach. A balloon is filled with water by a nurse or a doctor. If the balloon breaks, the tube will fall out. At the top of each tube, there are 1 or 2 ports. The small port, the medication port, requires a small oral syringe. The larger port, the feeding port, requires a 60 cc syringe. A Mickey requires a connecting tube to access. To access a Mickey button, you must use a connecting tube. To connect the connecting tube to the Mickey, line up the black marks on the tube and the Mickey and push the connecting tube into the Mickey. The black mark on the Mickey represents 12 o'clock on the clock face. Turn the black line on the connecting tube clockwise to the 10 o'clock position. In this position, the connecting tube is locked into place and locked open. You can complete a tube feed in this position. To remove the connecting tube from the Mickey, turn the tube counterclockwise, line up the black marks on the Mickey and the connecting tube, then pull the tube straight out. A thumb clamp is found on the Mickey connecting tube. Push the clamp to close it, push up on the top to open it. The clamp stops the flow of liquid in or out of the tube. A G-tube, PEG tube, GJ tube, or a J-tube may or may not have a clamp on them. To stop the flow of liquid into or out of the tube without a clamp, fold the tube in half completely. This is similar to folding your garden hose in half to stop the flow of water. There are many types of supplement. Some are high in fiber, others high in protein. Some contain more calories per 1 cc or milliliter. Sometimes people take different kinds of supplement at different times during the day. You must check the supplement against the MAR to assure you have exactly the correct supplement for each feeding time during the day. You will do 3 checks to the MAR to assure you have the correct supplement for the time you are administering. Check supplement for expiration date and contamination. These are done after your first check, just like every other medication. If you believe the supplement is contaminated, discard it by pouring it down the drain and throwing away the container. After your 3rd check, to prepare the supplement, you shake the can vigorously. Always wash your hands and put on gloves when providing supplement, medications, or water through a G-tube, and also when providing care to the G-tube site. When washing your hands, it is the detergent on your hands and friction produced by rubbing your hands together briskly that kills germs. The detergent must be in contact with your skin for 20 seconds. Turn on the water and adjust the temperature. Wet your hands and apply soap to your hands. Rub your hands together briskly. Rub the backs of the hands between the fingers and rub your fingernails into the palm of your hand. Rinse your hands from the wrist to the fingertips, allowing the water to run off your fingertips. Do not touch the sink. Take a paper towel, dry your hands. Take another paper towel, shut off the water, open the door, shut off the light using the paper towel. Deposit the paper towel in the trash as you exit. You have not contaminated your hands. Apply your gloves to your clean hands. There are 4 different methods of administering feeding tube formula, water, and medications. This is prescribed by the physician and delegated by the delegating licensed nurse. The most common methods include syringe bolus feeding, intermittent gravity tube feeding, continuous gravity tube feeding, and a pump feeding. The process of administering supplement, medications, and water for hydration is always the same. Water, medications, water, supplement, final doctor-ordered water flush. For only supplement administration, water, supplement, water, and the same for only medications. The amounts of water will vary for each person, but the process will be the same. Take exactly what you need with you. When everything has been instilled in the tube, you are finished with the task. The delegating licensed nurse will provide the DD personnel with specific tube feeding instructions. These instructions will include the type of supplement, the amount of each feeding, the number of feedings per day, the duration of each feeding or how long each feeding will last, the times of each feeding, and the tube flushes and amounts of water before, during, and after each feeding. For a syringe bolus tube feeding, the delegating licensed nurse will provide DD personnel with specific intermittent tube feeding instructions. These instructions should include type of supplement, amount of each feeding, number of feedings each day, duration or how long the tube feeding will last, times of the feedings, and tube feed flushes or the amount of water before, during, and after each tube feeding. Clean the work area, wash your hands thoroughly, and put on gloves. Assemble equipment you will need: supplement, water in a measuring cup, a 60 cc syringe that fits in the tip of the feeding tube. All liquids should be room temperature. Allow the supplement to warm to room temperature over 20 to 40 minutes if it's been refrigerated. Explain the procedure to the person and provide for their privacy. Position the individual as instructed by the delegating nurse. For a bolus feeding, the syringe tip is placed into the end of the tube. The bolus feeding is done with a 60 cc syringe. You will pour the liquid into the syringe and allow it to run in. A bolus feeding to provide water, medications, water, supplement, doctor-ordered water flush will take about 15 minutes to administer. A bolus feeding can be done with a G-tube or a Mickey. Flushing the tube helps to prevent the tube from becoming blocked. If a person uses a gravity bag, the person has demonstrated that they do not tolerate a bolus feeding. During a bolus feeding, they're given a large amount of liquid in a short amount of time. A gravity bag is used to slow the rate of the tube feeding down. There will be a drip chamber for observing how fast the supplement and water are running into the tube. A roller clamp will be on the tubing. It rolls up toward the bag to open completely or down away from the bag to close completely. A roller clamp is used to increase or decrease the flow of the supplement. It should be set about halfway or as directed by the licensed delegating nurse. When a gravity bag is used, the initial water, medications, and water are always administered by bolus method. Only supplement and the doctor-ordered water flush are administered through the gravity bag. For a gravity flow tube feeding, it will take approximately 60 to 90 minutes to complete. If the gravity feeding is continuous, it will be stopped by rolling the clamp all the way down away from the bag. The bag will be disconnected to administer water flushes or water, medication, and water, and then the tube will be reconnected to the gravity bag and the clamp rolled up toward the bag to open. The medications, water, and water flushes will be administered bolus method. When using a feeding pump, the licensed delegating nurse will provide DD personnel with specific information regarding continuous tube feeding or intermittent feeding, including specific information about using the pump. The instructions will include the type of supplement, amount of supplement per hour if the feeding is continuous, or if the feeding is cycled, start and stop times. Also, times and amounts of tube flushes and times of medication administration. Flushing the tube with water prevents the blockage of the tubes. Medications will be administered by the bolus method. Doctor-ordered water flushes may be administered bolus or pump. Tube feedings administered with a pump may run 24 hours per day and only stopped for water flushes and medications. If a person is unable to tolerate a tube feeding by bolus method, they have nausea, vomiting, diarrhea, belly pain, then the doctor will order a gravity feeding. If the person is unable to tolerate a gravity feeding due to the symptoms above, they will order a pump feeding. For a pump feeding, medications and water flushes are administered by the bolus method by pausing or stopping the pump during that procedure. Medications should be prepared at the time they will be administered, completing 3 checks for each medication against the MAR. Medications that have liquid equivalents will be changed to a liquid. Not all medications have a liquid equivalent. Medications that do not have a liquid equivalent will need to be crushed. If you are crushing medications, you will be given instructions by the delegating nurse. All medications must be crushed to a powder form. These can be mixed in a small amount of room temperature water. Medications can be mixed together. If they cannot be mixed together, you will not be administering at the same time. The pill crusher should be used only for that person. When administering supplement through a feeding port, always follow the delegating nurse's instructions and your agency's standard policies. When administering enteral nutrition, direct infusion of liquid nutrition into the stomach or small intestine, never administer formula through tubes or access ports other than the enteral feeding tube or port. You must make certain to correctly identify the feeding port. Remember, feeding tubes that are continuous, gravity or pump, will need to be turned off and the tube flushed with water prior to administration of medication via the same feeding tube port. The delegating licensed nurse will provide you with instructions on how to do this. The delegating licensed nurse will provide specific instructions for positioning of the individual and how to verify tube placement for the individual. The process is always the same. Begin with water. The delegating nurse will tell you how much. The initial water flush assures the tube is not blocked. Then administer medications, then an additional water flush to assure medications are not blocking the tube. Then administer the supplement and the final doctor-ordered water flush. This is for hydration. Try to avoid putting air into the person's stomach. Always remember, all liquids given through a feeding tube are given at room temperature. Do not use hot water. Do not heat the water, supplement, or medications in a microwave, over a fire, or on a stove. Check the temperature of the water by placing a few drops on the underside of your wrist. If it feels too hot on your skin, it's too hot to use. Water, supplement, and medication should be at room temperature prior to administration. The person should be positioned sitting up or with the upper body, the trunk, elevated greater than 45 degrees for verifying tube placement and for bolus and intermittent feedings. Allow them to remain in this position during the feeding and for 60 minutes after it's complete. For continuous feeding, the individual either needs to be sitting upright or with their upper body elevated greater than 45 degrees. Positioning is very important. Individuals receiving feedings and medications by feeding tube can aspirate if lying down or not upright enough during the feeding or medication administration. When a person aspirates, they inhale supplement, water, or medications into their lungs. This will set up an infectious response in the body. The delegating nurse will provide you with specific instructions regarding proper positioning of the individual. You may be asked by the licensed delegating nurse to verify the placement of the tube. Verifying the placement of the tube assures the tube is in the correct location inside the person. Check for graduation marks on the tube. Always assure the same number of lines is present on the outside of the tube. If the tube is not marked, the licensed delegating nurse can make a mark with a dark, non-toxic pen at the point where the tube enters the body. If the length of the tube is less than or more than normal, notify the licensed nurse. This is another way to verify placement of the tube. Collect your equipment, a stethoscope and a 60 cc syringe with a plunger. Draw back on the plunger to fill the syringe with 20 cc's of air. Fold the tube, open it, put the syringe in the tube. The syringe acts like a stopper in the tube. You can unfold the tube. No liquid will move in the tube until you push on the plunger. Place the earpieces of the stethoscope in your ears and the diaphragm, the part that you listen with, on the abdomen next to where the tube enters the body. Push the 20 cc's of air through the tube while listening for air bubbles in the stomach with the stethoscope. This will sound like blowing through a straw into a glass of water. If you're unable to verify placement of the tube, or if you have questions or concerns about the tube placement, contact the licensed delegating nurse as soon as possible. Do not use the tube until instructed to do so by the licensed delegating nurse. The final way you may be asked to verify placement of the tube is to aspirate using a syringe. The delegating licensed nurse will provide specific instructions if you need to do this task. Attach a 60 cc syringe to the end of the tube. Aspirate a small amount of gastric contents through the tube into the syringe. Aspirate simply means you put the syringe in the tube and draw back on the plunger. Observe the color of the contents indicating proper placement: clear, tan, light green, or brown. To prevent possible electrolyte imbalance, return the aspirated volume into the stomach by slowly pushing the gastric secretions back into the stomach. Follow with a 20 cc water flush. If you are unable to verify placement of the tube, or if you have questions or concerns about the tube placement, contact the licensed delegating nurse. Do not use the tube until instructed to do so by the licensed delegating nurse. The person's physician may order an X-ray to verify the placement. This is the most accurate way to check feeding tube placement. If prescribed, the stomach may be checked for amount of residual content at a specified time after a feeding to determine if the stomach is emptying properly and the person's body is using the food. In a healthy person, there should be less than 50 cc's of residual left in the stomach several hours after eating. The delegating nurse will tell you the amount of residual to report immediately. A good rule of thumb is a residual of 50 cc's or greater should be reported directly to the nurse. If the residual amount is more than what the nurse has told you is acceptable, do not put any food or medication into the feeding tube and notify the delegating nurse immediately. Use as many syringes as needed to draw out any or the complete contents of the stomach as directed by the nurse. Note the amount and color. Return the residual to the stomach as instructed by the delegating nurse. Guidelines for care of the insertion site and the feeding tube will be given to you by the delegating nurse. Check the skin at the site for redness, irritation, or leakage of stomach contents. Be sure the G-tube is not becoming embedded into the skin. Notify the licensed delegating nurse if any of these are present. Each day, use a gauze or a clean cloth to clean the tube and the skin at the insertion site with soap and water. Using circular motions, move away from the tube to the outer areas. Keep the area clean to avoid skin breakdown at the insertion site. Report any symptoms of distress, such as nausea, vomiting, breathing problems, choking, abdominal or chest pain, coughing, or fever to the licensed delegating nurse immediately and stop the tube feeding. These symptoms may indicate a potential problem and continuation of the feeding may be hazardous. Vomiting may lead to stomach contents getting into the airway and causing breathing problems or distress. If breathing problems occur, stop the feeding immediately and call 911. If an individual complains of abdominal pain, check the external bolster for proper adjustment and check the tube's position. If the tube cannot be rotated easily and move in and out freely from the stoma, it may be embedded in the gastric wall or pulled into the peritoneum. Check the skin for redness, swelling, buildup of fresh tissue, and leakage. Report any pain, leakage, redness, bleeding to the licensed delegating nurse. These conditions can be prevented by regular monitoring and care of the tube exit site. Anytime an enteral feeding tube has been prematurely pulled out, the delegating nurse should be notified immediately. This is particularly important because G and J tube tracks begin to close within 2 hours. You may be instructed by the licensed delegating nurse to cover the stoma with a clean dressing. In the event that the tube does become clogged, squeeze and roll the tubing with your fingers, moving slowly down towards the individual's stomach. Use a syringe to attempt to flush the tube with 50 cc's of warm water. The delegating nurse will instruct you on specific steps to take when a feeding tube becomes blocked. A blocked tube may be due to undissolved medications blocking the tube. The best way to prevent clogged tubes is by flushing the tube before and after every feeding and medication administration, or several times a day for continuous feeding with warm water as directed by the delegating nurse. If nausea or cramping occurs during a feeding, the feeding may be entering the stomach too fast. Contact the delegating nurse or follow instructions from the delegating nurse to slow down the flow. For a bolus feeding, lower the syringe. For an intermittent or continuous feeding, slow the pump administration flow rate. The nutritional supplement may be too cold. Contact the delegating nurse or follow instructions from the delegating nurse to warm the supplement, usually just allowing it to come to room temperature. If nausea or cramping continue, stop the feeding and contact the delegating nurse. For excess leakage around the tube, The delegating nurse will instruct you about what is normal leakage compared to excess leakage for a person. The nurse will provide specific steps for care of the leakage. Excess leakage from a tube insertion site or the stoma in the abdominal wall can often be corrected by adjusting the external bolster properly. If leakage persists, contact the delegating nurse. Apply a short-term dressing to absorb any excess leakage. Clean the area with mild soap and water. Do not allow wet clothes or wet dressings to remain in contact with the skin, as the stomach acid may cause chemical burns to the skin. Change the dressing and clean the area as frequently as needed. If the stoma is enlarged, the physician may replace the tube to improve stability. Bleeding, redness, irritation around or from the stoma must be reported to the delegating nurse. Feeding tube disconnection and spilling of the feeding tube supplement. Clamp the tube, clean the connections with soap and water, reconnect the tube, unclamp, and make sure it's running. Clean the skin with mild soap and water and pat dry. Notify the delegating nurse of the problem and receive any further instructions she may have. If an individual with a feeding tube develops an increased number of bowel movements or liquid bowel movements, notify the delegating nurse. Diarrhea may be accompanied by pain, cramping of the stomach, fever, or lightheadedness. Diarrhea may simply be due to the supplement. It may also be caused by soap film left on the feeding bag or medications. It may also be a sign of a serious bowel infection. Do not administer anti-diarrheal medications unless specifically instructed to do so by the delegating nurse. If a person with a feeding tube develops constipation, they may have to strain to have a bowel movement or have stomach pain or cramping. Constipation may be due to the supplement, not enough water intake, medications, or problems with the gastrointestinal system. Notify the delegating licensed nurse for instructions. The delegating nurse should also provide instructions regarding follow-up care or evaluations for constipation. If there's an emergency in which death or permanent disability may result within 1 hour, call 911. Remember, if you call 911, always place the person sitting upright or in the recovery position until emergency medical personnel arrive. Stay with the person, providing any care the person may need until EMTs arrive. Then notify the manager on call and provide reassurance to the other people in the home. All equipment for completing a tube feeding is washed in the kitchen sink with clean, soapy water. The equipment must be rinsed well to prevent tubes from blocking. All equipment is set in a dish drainer only for that equipment or on a paper towel to air dry. There will be a nail in the kitchen cupboard to hang bags to dry. All equipment is washed after each use. Hey, keep smiling and have a great day.